So today I want to talk about and give some pointers on what you should do in regards to receiving handoff report. So if you're new to kind of nursing, receiving handoff report is basically the nurse has been taking care of the specific patient or patients for 12 hours, and now they're giving you report and enough information so that you can actually provide adequate care to them. So the primary thing when you are receiving handoff report is to listen. Listen. Not just hear, but listen. That means you're comprehending what they are to say. And that is a primary thing, is that you're listening. Now, everyone absorbs information differently. So, someone saying report to them, just giving a whole bunch of words, sometimes it's hard. So for me, I'm a visual learning, but I also learn by actually hearing. And so a lot of times when I'm receiving report, and the tip for you is that if you are a visual learner, and you learn a little bit better. If you do have a capability to have a computer on wheels or a workstation on wheel, have that with you and open up the patient's chart while you are listening to the nurse give you reports. So that's something that I actually do. But the primary thing is that you're going to be listening. And so what I want to say is that a good nurse who is taking care of the patient is going to give you handoff report in a way that makes sense. I always say that you should give report in a way as if you're telling a story, which means you have to have a beginning, middle, and end. If you start at the end and then go to the beginning, everything, you're going to be confused as a nurse is receiving handoff report. So start at the beginning. So the beginning of handoff report should kind of look a little bit like this. They should begin by telling you first and foremost the patient's name, their room number, because that's vital, so you know who you'll be taking care of and you know where to go in order to take care of that patient. You first should be giving the date of admission when they came in, because that is important. And you also should be giving what was their primary complaint when they came in, right? And what are they currently here for? So what is their diagnosis? Not only that, they should be giving you medical history. A lot of people have a lot of comorbidities, but I would say pertinent medical history. They should be letting you know what their code status is, because it's important. God forbid you get report. You should have enough information from the time they give you report to the time you walk in to actually assess that patient, or if you're getting a handoff report or a bedside report, that if God forbid they're cold or have an ERT, you have enough information either in your mind or on your paper in order to take care of them. So their report should be thorough, and you should have that information. So yeah, I said code status. You should also know if they're in isolation, and if they are in isolation, what are they in isolation for? Is it enter precautions for C. diff, things of that sort. Not only that, you should know their mobility. You should know how they go to the bathroom. And if they do go to the bathroom, are they have a history of falls? Do they use a walker? Are they a total? Are they incontinent? Do they go to the bathroom on their own? Are they independent? Are they incontinent of bowel or bladder? Those are the things that should set you up. And you should also know if they have a line, right? That line can be an IV, a central line, just any of the things, midline. They should be able to tell you their orientation status, which means, are they alert and oriented times 4? Do they know their name? Do they know the year? Do they know the situation and where they currently are? Also, they should be telling you their diet. Are they on a regular diet? Are they on a cardiac diet? Are they on a carb control diet? Are they on a fluid restriction? And how do they take their pills? Do they take them whole, or do you have to crush them and put them in pudding? Also should be letting you know if that patient is on telemetry. If they are on telemetry, what is the rhythm that they actually are running? And then lastly, they should be giving you a synopsis of their skin. If they have wounds, they should tell you what needs to be done, what are the orders, how you should dress it, and when is the next time that you should dress it. So the tip in receiving handoff report is that a lot of us can't keep all this information because we either have 2 to 5 to 7 patients. That's a lot of information. So I would suggest having something to write information down, pertinent information. My tip is that I actually work out of Epic in both of the places that I work. And so I just go and print off like a handoff report from Epic, and it just gives me the brief synopsis, and then I fill in as I want there. So that's a quick tip if you don't want to write everything down. Some people find bring sheets of Etsy. If you have someone on their unit that already has a bring sheet and you want to look it up and look at theirs and it's great, copy that or make your own. That's what I did when I first started out. But also, main thing, just listen and have a good bring sheet, and you'll do great. Receiving handoff report can just be a little bit, a little crazy when you're starting out as a new nurse. But I want to just relieve you of all anxiety, is that that nurse is basically giving you enough information so that you can walk into that patient's room and be confident and take care of them. So yes, you're primarily listening, but if they're giving you a report, they're talking fast or all over the place, feel free at the end to ask questions and ask them anything that they did not give you, all the things that I stated before. If they did not provide you with any of that, feel free to ask them that. And a lot of things you can look up. It is in the computer charting system, but you want them to tell you these little things because they've been taking care of them for 12 hours, and some things you cannot get from the report unless you actually go in there. But hey, you can ask questions, but don't be interrupting every time they ask something. I think sometimes when you interrupt people in the beginning of in their handoff report, it just knocks them off of their socks. And you don't want to be rude. You want to give them time to talk. And at the end, if they don't give you enough information, then you can ask those things. So this is part 1. I'll come back tomorrow with part 2 on how to receive handoff report.